Today's training will be on point-of-care testing. For all urine drug screenings, we will be using in-office Blue Rapids point-of-care testing cups. For specimen collection, today we'll cover how to collect, prepare, and ship these testing cups. The first topic we will cover is how to collect the urine. All tests must be conducted in room temperature, 50 degrees to 86 degrees Fahrenheit. You will need to verify patient identification and have the patient sign and acknowledge the consent form. Once the patient has signed and acknowledged the lab requisition form providing consent, you will remove the test cup from the foil pouch by tearing at the notch and use it as soon as possible. It is important that you do not take the cup out of the pouch until you are ready to conduct a test. You will label the point-of-care testing cup with the patient's date of birth, first name and last name initials, and date it with today's date. Instruct the patient to urinate directly into the test cup. The urine sample collected must be above the minimum mark that is located on the left side of the testing cup. Inform the patient to wipe off any splashes or spills that might be on the outside of the cup. You will also need to observe the temperature strip on the testing cup between 2 to 4 minutes to see if the urine has been diluted by water or other liquid other than urine. And that temperature strip is right here. The urine temperature range should be within 90.5 to 99.8 degrees Fahrenheit. It takes 2 minutes to detect temperature. The temperature strip will turn green, and that's the temperature that you will record. Once you have collected the urine from the patient, you also want to make sure that you safely secure the cap, check the cap for a tight seal, and place the cup on a flat surface before reading the temperature strip. You also want to start a timer for 5 minutes, and you'll peel the label from right to left. Check the temperature, document the results, seal date, and initial the urine testing cup in front of the patient. Never read the results after 5 minutes. When reading the results, please note that a preliminary positive test result does not always mean a person took illegal drugs. Nor does it mean a negative test result does not always mean a person did not take illegal drugs. You want to document positive and negatives onto the lab requisition form by reading the results from the testing cup. On the bottom of the testing cups, there will be a reference guide for you, just like this here. It will have a control line, test line, and then your positive, negative, and valid. If you have one line with a control line, that would be a positive. If you have a control line in red and a test line in red, that would be a negative. Notice on this one, you have a control line in red and you have a testing line in a slightly different shade of red. This is still a negative, regardless of the shade of red. So 2 lines is a negative. If you have a result where it has just one testing line in red, that is invalid. You will record these results again onto the lab requisition form. You'll want to make sure that you're reading the results within 5 minutes. Each strip will change color after 2 minutes. You will remove the label to view the results, and you will remove it from right to left. Each reagent strip will change in color and show positive, negative, or invalid. The following information will need to be documented onto the lab requisition form. You will document the patient's date of birth and account number under patient information. On the right here, you will mark if it is a commercial insurance or Medicare or Medicaid or workers' comp, and list the date of injury. You will select the patient's diagnosis and check yes or no if the temperature was within range. You will select the ordering provider by selecting a check mark next to the provider's name. You will enter the date that you collected the specimen, the time that it was collected, and then enter your full name. This is where you'll have the patient giving authorization and consent for today's point-of-care testing. You'll have the patient's sign and date. Under Marked Prescribed Medications, you will select all the medications that the patient is currently on. Under Record Point of Care Results, this is where you will mark all the positive and negatives and invalid results that you read off the testing cup specimen collection. Under Record Point of Care Results, you will mark all the positives and negatives or invalid test results from the point of care testing cup. On the front side of the page, there will be a section where the ordering provider will need to initial that they reviewed the results, make a selection on a confirmation panel, and put in the risk level of the patient, whether it's low, moderate, or high, and the reason for the urine drug testing. The ordering provider will also need to either make a selection to not order confirmation testing or to order a confirmation testing and then make a selection why, and then sign and date. For every urine drug screening test, you will need to submit an order into the patient's encounter within Savocity. You will open the patient's chart, verify the patient information, click on the Orders Referrals tab, add an order for drug test, CPT code 80305. You will save and close that file. You will also print the patient's demographics page. The patient's demographic page is important for the lab to obtain patient information, the site and location that the testing was conducted, and who was the ordering provider or medical assistant that did the collection. In this screenshot, you can see that there are 6 fields that must be completed when entering the order. You must select the modifier, QW, which will auto-populate if you selected it from your Favorites tab. The indication will be the patient's diagnosis. You'll need to make sure that you selected the correct ordering provider. The bill must be checked, status must be complete, and you will enter the date of collection here, and then click Save. After the provider has completed the requisition form, print the patient's demographics page in Savocity. Make a copy of the requisition form, scan the original into the patient's chart. Place the urine specimen cup, the patient demographics, and the copy of the lab requisition form inside the shipping pouch. Label and seal for transporting to the lab. The lab staff will scan all confirmations into the lab share drive that you will all have access to. Urine drug screening staff will continue to scan all confirmations into the patient's encounters within Savocity. This concludes our training on the point of care testing cups. Next, I will walk you through Savocity on how to submit the order. Now I'm going to show you how to print the lab requisition form within Savocity. So what you want to do is click on Tools, scroll down, come down to Patient Handouts, and then go to Patient Handouts again. Under Category, what you'll do is select Alamo State Labs UDS order. Make sure that the summary states POCT-order consent. Click on that. And for today's training, I am just going to click on Print Preview. And as you can see there, it pulls up your lab requisition form. This allows you to have the form within Savocity. Please note that patient handouts are for printing and viewing only. They will not be saved into your preferences. So I'm going to go ahead and exit out of that now. Now I want to show you how to submit an order. First thing you want to do is open the patient's chart. Click on Orders. Click Add. Under Category, you'll find a category that says UDS-POCT. You'll select that. Double click on Drugs Test. For the modifier, you want to make sure that you are selecting QW for CLIA wave testing. Under the Indications tabs, this is where you will enter the patient's diagnosis. So I'm just going to select low back pain today and chronic pain syndrome. For the ordering provider, it's important that you put in the provider that is ordering the urine drug screening test. So for today's training, we'll just select Dr. Dar. You'll click on Bill. For status, it's important that this shows complete. And then for date, you're going to put today's date on there. So let me show you. Click 27th and click Done. There's a total of 6 steps that need to be completed in here. The modifier, the indication, patient's diagnosis, the ordering provider. It needs to be marked as billed, status complete, and the date of collection. Once you are done, click Add, click Done, and save. With training, we will also be providing you with handouts on how to print the lab requisition form. As you can see here, it goes through the steps I just walked you through with screenshots. And up above here is a how to create the order and walks you through those steps as well, with a screenshot of the 6 fields that must be completed. You will also receive a how-to on the lab requisition form, highlighting all the areas and fields that need to be completed for every urine drug screening. You will also receive a copy of the policy guidelines. Thank you all for your time and have a great day.